Our first priority is the health and safety of our communities. We have listened to our community and have heard your concerns, questions, and hesitancy on receiving the COVID-19 vaccine, and we want to answer some of those questions for you. Some of our patients are waiting to see if the vaccine is actually safe. However, more than 170 million Americans have been fully vaccinated as of today. On August 23, 2021, the Pfizer COVID-19 vaccine was fully approved by the FDA. Based on really large studies showing safety, this recent approval and many vaccines that have been already administered, we feel confident that it has a strong safety record. Another concern that people have is side effects of the vaccines. So the side effects of the COVID-19 vaccines are short-lived, unlike the full effect of COVID-19, which can last for a very long period of time and may cause long-lasting damage. Not only is COVID-19 pneumonia a devastating disease, especially the new variant, but also there's an illness called long COVID, which we still don't really understand much about. But I have been seeing patients suffer from it, and it can render a patient disabled with pain, shortness of breath, fatigue, palpitations, numbness and tingling, and so on. Common side effects of getting the COVID vaccine are injection site pain and swelling, and muscle pain, fever, chills, and fatigue. These are actually a really good sign of your body making antibodies to help you fight the virus. These are treated with cold compress, drinking lots of water, ibuprofen or Tylenol, and lots of rest. Another concern is endocarditis or pericarditis, which is inflammation of the heart after getting COVID vaccine. According to Dr. Paul Offit, this is a pretty rare side effect, although it could be a real side effect of the mRNA vaccine, but this event is very rare and very short-lived. Most of the cases resolve by just taking ibuprofen alone. He has a really good analogy, which I really like. If you have a room of 100,000 people and you give all of them the mRNA vaccine, 2 of them will probably have this short-lived side effect. But if you don't give anybody the vaccine, 1,300 will get COVID-19 and 100 will get hospitalized. 2 will get the multi-system inflammatory syndrome and 20 will die. For those who have contracted COVID-19 before, we still encourage you to get vaccinated so that it gives you longer lasting immunity and help us stop the spread. Many young people don't feel that they need the vaccine because they don't think that they'll get very sick from COVID-19. However, recent studies show that you're twice as likely to get hospitalized with the new variant. And we're seeing younger and younger people who are severely sick today. I think I can say this on behalf of all of the providers and nurses who take care of people in the hospital and the emergency room here in Othello. We're exhausted and the hospitals are full and overwhelmed, but more importantly, we're scared for the patients whom we might lose over a preventable disease. For example, in the past 2 weekends, I've been the on-call provider for the hospital here in Othello. We have had many young individuals admitted for severe COVID-19 pneumonia. Some we had to transfer to other larger hospitals. Some were not able to transfer, although they're very sick, because all the hospitals are currently full in the Washington state system. It is possible that you can still get COVID-19 after getting vaccinated, but remember, our goal is to get back to normal. Normal being no more restrictions and no more masks. Although there are rare breakthroughs in the community after vaccination, it is not as severe as when the vaccine is involved. Getting fully vaccinated lowers the likelihood of a new variant of the virus emerging. If you are currently pregnant or trying to get pregnant, we still think that it's safe and important for you to get the COVID vaccine. So the CDC analyzes data from thousands of pregnant people who received the mRNA vaccines and found that no increased risk of miscarriage in early pregnancy. And over 150,000 patients who are pregnant have reported to have gotten the vaccines. No safety concerns for pregnant people or their babies have been found. On the other hand, doctors all over the country are seeing more and more pregnant people with COVID-19 infection, and they're getting sicker and sicker with the new variant. Many are fighting for their lives in the ICU and their babies' lives as we speak. So we encourage all pregnant people or people who are thinking about becoming pregnant and those breastfeeding to get vaccinated to protect themselves from the COVID-19 infection. We hope that we were able to answer some of your questions about the COVID-19 vaccine safety. If you haven't done so and want to receive the COVID-19 vaccine, give us a call and schedule an appointment with us today.